We were asking healthcare workers what are their experiences of working through the pandemic, their levels of psychological distress, what are their biggest concerns, kind of their main fears, what types of strategies they've used to reduce their stress, and any recommendations that they have for their organization to help best support them through the pandemic. What we found from the first wave and what we're finding now, I'll just say that 403 healthcare workers completed our survey in wave one. And we've got almost about, I think, 150 healthcare workers completing wave two. And what we're finding for both waves is a significant amount of psychological distress. For wave one, we found that 70% of our sample were reporting experiencing high levels of psychological distress. And for wave two, I think it's over 83% are experiencing high levels of psychological distress. So what that means are symptoms like restlessness, fatigue, trouble sleeping, depressed mood, anxiety, which are normal emotional responses to a pandemic. I think many of us are experiencing more than our usual amount of anxiety or stress at this time. But despite their fears, being afraid, being at high risk of exposure, healthcare workers are showing up to work. They're choosing on behalf of the most vulnerable in our community every day, over and over. But what we know from past research is that this high level of stress takes a toll in the long run. It can result in burnout and absenteeism and just extreme exhaustion. And when that happens, it can negatively impact patient care, and it can impact the ability of teams and organizations and the health system on a whole to meet the needs of our patients. I think what's really critical to being able to develop effective supports and resources for healthcare workers is just first understanding what their experiences have been and what's really driving that anxiety and fear, so that organizations and leadership can focus on addressing those specific concerns. What most concerns me is that these high levels of distress really do take that toll in the long term on those who are on the front lines and who are working long hours and who are working in challenging work environments. And I think that puts them at risk for long-term physical and mental health issues.